All right, today we are diving into one of the most incredible comeback stories in all of human biology, the body's recovery after childbirth. We're going to visually map out the critical pathophysiology you absolutely need to understand, from that first crucial hour all the way through the weeks that follow.
So let's just jump right in with a high-stakes clinical scenario. Picture this. You walk into your patient's room and she's pale, she's restless, her pulse is racing, and her pad is completely saturated with blood. What is going on inside her body? By the end of this walkthrough, you'll be able to visualize the exact physiological cascade causing these symptoms and know exactly what you need to do.
So here's our game plan. We're going to start with that critical first hour, then we'll get into the amazing process of involution, we'll break down the timeline of lochia, cover the full body reboot, and then, most importantly, connect assessment to intervention and show you the red flags you absolutely cannot afford to miss.
Okay, let's kick things off with Section 1, the first hour. The clock on postpartum recovery starts ticking the second that placenta is delivered. And this first hour, well, it's the most critical phase of the entire process.
This whole 6-week period is an incredibly active, highly organized biological project. I want you to think of it like a controlled demolition and a renovation happening all at once. The body has one primary mission: to systematically reverse every single change from pregnancy and get back to its non-pregnant state.
All right, Section 2, involution. Now we're talking about the absolute star of the postpartum show. It's a process called involution, which is just a fancy word for the rapid and pretty dramatic shrinking of the uterus.
So, why does this happen so fast? Well, the key is to visualize the uterus as this powerful interwoven muscle. Right after delivery, a huge surge of oxytocin triggers these really intense contractions. And this isn't just about shrinking. This is a life-saving mechanism. These contractions clamp down hard on all those open blood vessels where the placenta used to be, basically acting like a natural tourniquet to prevent a massive hemorrhage. And the scale of this transformation, it's just staggering. The uterus goes from about 2 pounds, roughly the size of a grapefruit, all the way down to just 2 ounces, about the size of a pear. And it does this in only 6 weeks. This is truly one of the most rapid anatomical changes the human body can undergo. And what's really amazing is that you can actually track this internal process from the outside. By palpating the abdomen, you can feel the fundus, that's the top of the uterus. It should be moving down about 1 centimeter or 1 finger width every 24 hours. By about day 10, it should be back behind the pubic bone where you can't even feel it anymore. This is a key physical assessment that tells you recovery is on track.
Now, this slide shows the #1 enemy of involution, a full bladder. For your exam, you have got to picture this clearly. The bladder sits right in front of the uterus. When it fills up, it's like a roadblock. It physically pushes the uterus up and off to the side, and that prevents the uterine muscle from contracting the way it needs to. The uterus gets soft and what we call boggy, and those open blood vessels can start to bleed freely. Okay, on to Section 3, lochia. I want you to think of lochia as the body's daily progress report on how that uterine healing is going. It's the discharge shed from the uterus, and it tells us a story about how well the old placental site is recovering.
And this slide shows that predictable healing timeline, and you can see it right in the color of the lochia. It starts as bright red rubra for the first few days. Then, as the initial bleeding slows down, it changes to a pinkish-brown serosa. And finally, as healing is wrapping up, it becomes a whitish alba, which is mostly white blood cells and tissue debris. This progression is a critical sign of normal healing. If that color ever goes backwards, say, from serosa back to rubra, that is a major red flag that something's wrong.
Now, it is not enough to just look at the color. You have to quantify the amount. This is a critical distinction you need to burn into your memory. Heavy bleeding, saturating a pad in 1 hour is definitely cause for concern, but excessive bleeding, saturating a pad in just 15 minutes, that's an act of emergency. That is the classic sign of a postpartum hemorrhage. Section 4, the full body reboot. You have to remember, this uterine recovery doesn't happen in a vacuum. Those same dramatic hormonal shifts that are driving involution, they're also triggering a massive system-wide reboot across the entire body. So let's decode these vital signs. It's actually pretty normal to see a slight temperature elevation in the first 24 hours, and that's usually just from the exertion and dehydration of labor. You might also see the pulse drop as low as 50. This is called puerperal bradycardia. And here's why. During pregnancy, the heart was working overtime to pump a much larger blood volume. As soon as that volume drops after birth, the heart just doesn't have to work as hard, so its rate slows down.
A resting pulse over 100 though, that's a red flag for hemorrhage or infection.
This slide really just shows how interconnected everything is. The main driver here is the delivery of the placenta, because that causes estrogen and progesterone levels to just plummet. This hormonal crash does two huge things at once. First, it signals the kidneys to start a rapid diuresis to get rid of all that extra fluid from pregnancy. And second, it removes the brakes on prolactin, which can now surge and kickstart milk production. It's a beautifully coordinated response.
Okay, Section 5, Assess and Intervene. We've gone over the pathophysiology, the why. Now, let's translate that knowledge directly into action at the bedside. This is all about connecting the why to the what you need to do.
Okay, listen up. This is an absolutely critical, non-negotiable point for your exams and for your practice. You always have the patient empty their bladder before you assess their fundus. We already saw why. A full bladder gets in the way. But just as dangerously, it can make a soft, boggy uterus feel deceptively firm, completely hiding a developing hemorrhage.
So if you assess the fundus and it feels soft and boggy, kind of like a sponge instead of firm like a grapefruit, you've just identified uterine atony. Your immediate first-line intervention is to begin a firm fundal massage. This direct physical stimulation literally forces those uterine muscle fibers to contract and clamp down on the bleeding vessels. It's your first and most important action to stop a potential hemorrhage.
And finally, Section 6, Postpartum Red Flags. Now that we have a really clear picture of what normal recovery looks like, the dangerous deviations, the red flags, should stand out in really sharp contrast. It is so important to be able to tell the difference between the very common postpartum blues and clinical postpartum depression. The blues are temporary. We're talking mood swings and tearfulness in the first week, driven by hormones and just sheer exhaustion. Postpartum depression is a persistent, serious medical condition characterized by a loss of pleasure, overwhelming guilt, and maybe even thoughts of self-harm. Recognizing this difference can literally be life-saving.
Let's go back to that daily progress report, the lochia. Normal lochia should have a kind of fleshy, earthy odor, similar to a normal menstrual period. But if you detect a foul, rotten smell, that is a major red flag for infection. Remember, the postpartum uterus is warm, it's dark, it's vascular, it's basically a perfect breeding ground for bacteria. This sign needs immediate investigation.
And this is arguably the most immediate, life-threatening red flag. This specific phrase, a pad saturated in 15 minutes, is the textbook definition of postpartum hemorrhage. It's not subjective. It's a clear, quantifiable sign that your patient is actively hemorrhaging and needs help right now.
And that brings us full circle, right back to where we started. That patient, pale, restless, tachycardic, bleeding heavily. But now you can visualize exactly what's happening inside her body. Her uterus is boggy, it has atony, and it is failing to contract and clamp down on those open blood vessels. You know your first move is to massage the fundus, and you know your very next move is to call for help. This is a postpartum hemorrhage, and you have just connected all the dots, from the deep pathophysiology all the way to decisive, life-saving action.